Hi, my name is Yvette Jackson. I'm the Executive Director of Devereux Arizona. We're really excited that you've joined our team as we work together to make a difference in the lives of the individuals we serve. Welcome aboard. I look forward to meeting you. Devereux is just an amazing place. We're an organization that is very passionate. It's an organization built on people. We have therapeutic foster care, an outpatient clinic for adolescents, an adolescent health and wellness clinic, about 8 respite homes across the state, a residential treatment center in Scottsdale, Arizona, and we have an assessment and intervention center in Tucson.
We have kids as young as 2 years old that we provide outpatient services for that might be diagnosed with autism. We have a lot of kids that we see are exhibiting some really challenging behaviors, physical aggression, a lot of mood dysregulation, depression, post-traumatic stress disorder, and then some children that are actually struggling with psychosis. In residential treatment, we absolutely see the most complex cases that you could possibly imagine.
We're working with them on trying to make sure that they're able to use some coping skills and you be able to kind of just deal with everyday life.
We do foster care, therapeutic foster care. We also have outpatient clinic where people are coming to us for outpatient therapy services, psychiatric services.
Many of the kids, when you see the referral packet, it makes you just want to cry. They've had like 14 failed placements, and they've disrupted out of foster placements, and then they've been disrupted out of group homes, and then they find themselves coming to Devereux.
Our role is really to meet them where they are at that time in their development to provide them with the most accurate service that we can.
Working with special ed has always been a passion of mine. We manage behavior, we modify classwork, we're their role models. Working with the class that I work with, I absolutely enjoy.
Evidence-based practices are a part of all of our programs. It is crucial for us to follow practices and protocols and programs that are rooted in evidence that we know work. Our residential treatment center is known to be a specialty provider specifically for the transgender population.
A lot of foster care youth happen to identify as LGBTQ. It's very helpful to be able to have families that understand that.
We are a place for people who are LGBTQ to work, to get treatment, and to get care, and that they will be treated with respect.
I think Devereux is a great place to work because it truly cares about the clients that they're serving. It cares about the employees that they have.
We got great staff, we got great facilities, we have great programs. They really attack it from multiple angles.
Anyone that goes into the field of behavioral health that is choosing to work for a nonprofit is a very, very special person.
Our staff don't have to worry about some of the things that maybe other staff have to worry about in other organizations because of the support that we have from our national office. I have benefited just immensely from this organization.
Over the 15 years, there's been situations where I personally needed to take time off or step away, and I never felt like my job was in jeopardy.
Devereux does support and offer us a lot of trainings, off-site and on-site.
I'm in nursing school and I'm finishing nursing school, so they have a scholarship program where they reimburse.
I've had people along the way that have encouraged me when maybe I didn't see that in myself. Supervisors that have said, you should go back and get your master's degree. You should be a social worker. And then the next year I went and did it. Someone who I respected asked me to do that and then supported me and said, yeah, you can do it while you're working, and it's okay if you have to have an adjusted schedule so you can go to a class. That benefits us. You're learning something, you're progressing.
I don't think I've ever worked in an organization where there's been so much teamwork. We meet once a week with the clinicians and we get a chance to talk about the kids. They give us further insight on the kids' diagnosis, what's been working for them, what's not working for them.
The Devereux Family Standard is quite simple to explain. If my family member were coming to get services, how would I want that family to feel, to be treated from the moment they walk in the door to the moment they leave our care, making sure that it meets my standard for what I would want for my family.
Devereux has given us all the support we need. Whenever we're in need, if we are in crisis with a kid, something is going on in our life and we need some type of relief, they're right in with respite, or do you guys need anything else? They've had to come to our home in the late evening or late at night. They're there.
When you see a kid come in who can't advocate for themselves and doesn't speak, and by the time they leave their voice and their opinion, they're sticking up for themselves and they're fighting for what they believe they need. I've seen kids come and apply for a job. I've gotten letters for kids who graduated high school, and not just 1 or 2 kids. Over the 15 years, I can probably count on all my fingers and toes.
The first day they get here, witnessing all their behaviors, and then when they leave, because you can see the dramatic difference. That's why I work with the kids.
The best job in the world is one that you would do for free. I don't feel like I'm working when I come to work. I love that I get to go home every day, lay my head on the pillow, and I've done soul-satisfying work.
Welcome.
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 Welcome to Devereux.
Welcome to Devereux, Arizona.